Dr. Peter Butt is with the University of Saskatchewan. He is an addictions specialist. Hi, Peter.
Good afternoon.
Why are Saskatchewan's alcohol-related hospitalization numbers so high, do you think?
Well, I think that there's a number of factors, and to a certain degree it's not surprising when we see how many problems we have with drinking and driving. Clearly we have an alcohol problem in the province, and what CIHI has shown us is that we have high hospitalizations directly attributable to alcohol. I think it's because of consumption and consumption patterns related to availability, which has been heavily promoted by the government, rather than an integrated alcohol policy or an integrated alcohol strategy that takes into consideration not only the availability of alcohol, but also the impact that it has on individuals and communities.
Tell me more about what could change these numbers and send a different message that would change people's behavior, because that can be a difficult thing to do.
That's right. And when we look at the health impacts of alcohol, we have to think about two things. One is the acute impacts. When people are intoxicated, they might have an accident, experience some trauma, get into a fight, those sorts of things. And then there's the chronic impact of alcohol due to the ongoing drinking, typically at high levels, but not necessarily binge drinking, that accumulates over time, over years, and the health impacts that have. So when we look at health impacts, we need to be thinking about consumption. And one thing that isn't well promoted in this province compared to other provinces are the national low-risk drinking guidelines. Quebec, for instance, heavily promotes the national low-risk drinking guidelines to a level that over 75% of the population know them. They know what the numbers are for males and females, and it's become normalized as part of their conversation around alcohol use.
Let's talk about that, the social acceptance of drinking. Often it's promoted in a way that says, hey, having a drink is a great way to relax. It's a great way to enjoy yourself with friends. And I suppose in moderation that can be true, but oftentimes do you think that it contributes to the problem, that socialization of drinking being acceptable?
Well, yes, and I don't think that we need to go to the degree of prohibition. I think people can socialize with alcohol at a low-risk level and enjoy the company of other people. Moderation is in good taste. People don't have to binge drink in order to enjoy themselves socially. And I think this is part of the problem when we look at the culture of drinking within Saskatchewan, and who knows, perhaps this extends to the cabinet table. It's difficult to say when you begin to look at what public policy we have around alcohol in the province. But we have more of a frontier pattern where there's heavy episodic binge drinking, which is what CIHI has identified as being problematic, particularly in rural and remote areas of the country. So that has an impact in terms of the provincial approach to drinking, that it normalizes heavy episodic drinking, which then leads to health problems.
How does a person know if they have a drinking problem? Is it defined by being a binge drinker?
Not necessarily. What we do know, though, is as people consume more and they get into that elevated risk or high risk category, they're more likely to have problems. And really, basically, we look at the severity of an alcohol problem in reference to the different types of negative consequences that they're having. Are they using in a way that puts them at risk? Are they using in a way that's out of control? Can they not shut it down when they go out to drink, when they realize that they've spent enough money or they're beginning to get into difficulty in their relationships? Is it impacting the relationships at home, at work, at school? Are they out of control? Is it compulsive? And does it continue in spite of these negative consequences? Those are the sorts of filters that we use in terms of looking at whether or not a person has a problem. And frankly, because this is often acted out in a social context, it's usually the workplace or the family that recognizes a person has a problem long before a physician might, in terms of the impact on their health.
Thanks for your time today, Peter.
My pleasure.